Okay, let's come to the important things. The important stuff here along with the CVP is the pulmonary artery pressure, pulmonary artery wedge pressure, and LV, left ventricular and diastolic pressure. I'm gonna skip talking about the RV pressure because, as I said, usually we check it only during insertion, and really we don't have much clinical value of that during our management. We mainly focus on these numbers we just mentioned, the CVP, and now we're gonna talk about the pulmonary artery pressure, the wedge pressure, and diastolic pressure. Before that, I wanna explain this to you. Let's assume we have this duct. We have from A to B. Let's say we have a chamber here and a chamber here. And let's say there is a pump that pushes the blood or the fluid from A to B. Of course, the pressure will be higher here. Let's say it's P. So always, as we talked in our mechanical ventilation, things move from higher pressure to lower pressure, and will keep moving until they equilibrate, and this is equal to this, and the movement stop. Let's assume I have a valve here, and during any moment, if I close this valve, if I check pressure right here, it will give me the pressure that built by the column in this area, right? Let's say this is C. From C to B, this column will give me the pressure, and when this pressure equilibrate, the pressure in this area in C will be equivalent to the pressure in B, right? This is exactly, if this is pulmonary artery and this is the LV, left ventricle, and this is the catheter here, or the valve, the pulmonic valve, when they close, or if the catheter, if I inflate the balloon, or they call wedging, that's what wedging, you inflate the balloon at the distal tip of the catheter, so you block the flow from this side here, and you give time, a few seconds to things to equilibrate between here LV and here the tip of the catheter. Then you measure the pressure here, will give you the pressure here, and that's how we say the pulmonary artery wedge pressure, give you an estimate on and approximately equivalent to LV in diastolic pressure, as long as the flow, there is no obstructions, there is no turbulence, things, and the compliance are okay. The same thing apply. So that's pulmonary artery wedge pressure. Basically, here at this balloon, we inflate the balloon, so it's block the flow from here, and the flow from here through the pulmonic vein until the left atrium, and then LV, as long as the mitral valve functioning okay, as long as the compliance here okay. So the wedge pressure, the closing pressure, that's what we call pulmonary artery occlusion, or wedge, or capillary wedge, they are all the same because we occlude this area. So and then you can directly measure this and give you an idea about this. In clinical practice, the most important thing about pulmonary artery wedge pressure is that it gives you an idea about LVEDP, or LV filling pressure, and we'll talk about how to use that shortly. But I just want you to know that you have to be careful, as long as the compliance is okay, the valvular function are okay here, and the mitral valve, so it can give you a good rough estimates about that.